Hello, everybody. Welcome to Pull Up with Limbs and Things. This is March 2024, and we're talking tonight about aging and essential oils. And we have Dr. Anita Lee. She's a fellow physical therapist, and she is a graduate of my alma mater, Alabama State University. And tonight we're talking a little bit about how essential oils can help us as we get older. And so I've had some conversations with patients where we tend to not know enough information and we tend to dismiss or ignore it. And so tonight we're trying to bring some clarity to some of those things because it can possibly be the difference between whether you have that surgery, whether you take that medication, or whether in some cases you just don't thrive. And so tonight we're going to talk about those things. So welcome, Dr. Lee. How are you?
I am awesome. Thank you so much, Dr. James, for
Yeah,
inviting
I'm
me.
glad to have you. Tell us a little bit about yourself and how you got into this realm of physical therapy.
Well, I've been a therapist for 12 years, and I think I've always had a knack for the holistic side
Mm-hmm.
of life, and making sure that we address all of us, which is
Mm-hmm.
body, soul, and spirit. So I think I just continue to learn through the years on how I can start switching out, using things more natural, whether it be, over the counter medicine or personal care products, things of that nature. Just really, trying to switch out things that better served my body and my family's body well. Um, a few years ago, while my son was maybe one or two, he had a lot of just horrible, almost asthmatic like
Mm-hmm.
reactions to different things, and so I researched, like any good mom would do. I Googled,
Mm-hmm. Oh,
what are some things that I could be doing to support his lungs,
yeah.
because the doctors do a great job at treating what's going on or putting a band-aid over it, but getting to the root cause of things, it calls for some research and some digging. So researched some things and found out that most of my cleaning products actually cause lung damage. So
Mm-hmm.
that was like a light bulb going off, just switching out cleaning products, and then eventually using essential oils to replace things that, like if we would catch a cold, we would use eucalyptus and things of that nature in order to support our body. So that's how I got into it. And then I started using it in the clinic. So working in an outpatient clinic for physical therapy, I noticed that my patients were recovering quicker from surgery after they applied essential oils, certain essential oils.
Mm-hmm.
And after I used, oils for massage along with the regular massage oil, I just noticed quicker turnarounds. I was able to warm the muscle faster, and the pain rate went down. So that's a little bit of my story.
Well, that's a big part because a lot of what we do and what we're trying to accomplish, even from my point of view, is helping people with the daily things that they encounter. So, like sleep.
Mhm.
Those people who are frequently in the bathroom and unable to stay asleep for the duration at night. So let's talk about that. In the essential oil world, if someone is having some difficulty sleeping and they cannot seem to manage it because they've been given medication, all of the sleep aids, all the
Mhm.
sedatives to try to help you go to sleep, but you're still having difficulties with it.
Yeah, so just to back up just a little bit, I
Sure.
want to explain what essential oils are.
Mhm.
Essential oils are not the fatty oils that we cook with. So, like the olive oil, the grapeseed oil, this is actually extracted or distilled from leaves, from petals, from tree bark, from resins. And once they're distilled, this is it's encapsulated in a bottle, and this is the most powerful component of the plant. So for instance, if you are a tea drinker, you use the entire herb and you basically soak it in water and you get all the
Mhm.
nutrients out of that dried herb. Well,
Right.
essential oils take are the strongest component of that herb and put it concentrated in a bottle. And the same thing that it does for the plant, like as far as, healing the plant, you use it for, they use essential oils to help with infections. The same thing that it does for a plant, it does for us when we put it on us. So essential oils are very powerful. They're very small in molecule. So they can cross into the cell membrane, and that is huge. So you have something small enough to cross into the cellular membrane as well as the blood-brain barrier. So
for those who don't understand those terms, make it plain for us.
I'll break it down. So when you inhale, smelling an essential oil, I've got peppermint right here. When I smell, automatically within 3 seconds, it goes up my nose, and then it hits the nerve that goes, the olfactory nerve that goes to the brain. And right here at the front of your brain, this is called the frontal cortex, but this is where our limbic system is, and this is where our emotions are. So that is why when you inhale oils, just sniffing them for a few minutes, it can help calm you down. It can help lower cortisol levels. Anything that's going on in the brain, it can induce sleep because melatonin is produced in the brain.
Yeah.
So I want to backtrack that. So you asked about sleep.
Yeah.
One issue that we see with our older population is they are taking a whole bunch of medication.
Whole bunch.
And all of these medicines have an effect on our gut health. So have an effect on how we absorb nutrients, how the medicines work. So some of the doctors are going to give you more medicine because that medicine's not working. So we have to address the body and look at the body from the inside out. But one thing that I think, one oil that will help with sleep is lavender. So lavender oil is like one of those Swiss Army knives, like it's so many uses. And like I said, just inhaling lavender oil, putting it in a diffuser would help. But it's best to put it on the body so that it can cross over into your bloodstream, and then it can go where it needs to go, so that your sleep can be full and great.
So let's talk about essential oil application, since you talked about smelling it versus topically putting it on yourself. Are there any other ways that essential oils can get into your body?
Yes, there's 3 ways. So I already talked about inhalation, and that's, as simple as putting a drop of lavender or peppermint in your hand, rubbing it together and inhaling like that. And then, or you can put it in a diffuser, which is like a humidifier. And you just drop like 3 drops of oil in there and let it disperse in the room, and it smells great, and you're getting all the health benefits from it. All right. Another way is topically. So anytime you put anything on the skin, good or bad, it will be absorbed by your bloodstream.
Right.
Okay. So within 20 seconds of putting oils on your body, it will have went through your whole circulatory system. That's very quick, just by putting it on your
20 seconds.
Yes.
20 seconds.
20 seconds.
I didn't know that. Okay.
Yep. Because they are huge oxygenators, so they carry oxygen, and so they ride onto those red blood cells. Okay. So putting it on topically, so I use it, you basically apply it where you need it. So if it's something going on with your tummy, you rub it on your stomach. Something going on, if you need support for your kidneys, you rub it along your kidneys. Another great place to apply oils is on the bottom of your feet.
Yeah.
Because your skin is thick and your pores are large on the bottoms of your feet. Another way that you can use oils is internally. And I wouldn't recommend that you do this with any type of oil. Make sure that the brand is legit, and that it's not something that you get or buy in the stores. But you can put oils in a capsule along with a carrier oil. That's like a grapeseed or a coconut oil, but and swallow it. So that's internal. Um, Oils are great because they absorb wonderfully in the small intestine,
Mm-hmm.
and they also help supplements if they're paired with supplements or vitamins like vitamin C, vitamin D. It increases absorption by 75%.
Mm. I'm learning a lot tonight.
You learned
Yeah.
a lot.
Okay, so that's really good. If you're watching and you have a question, please put it in the chat. Well, as always, pull up with Limbs and Things is to confirm something you know, to challenge something you don't know, and to give you an opportunity to share that information with someone else. So we talked about sleep. We talked about the 3 ways that you can get it inside your body. Are there any effects that we should know about using one way to get the essential oil into your body than the other?
You mean like precautions?
Yes.
Okay, so that's a great question. So I always tell people start low and slow.
Okay.
So low means start below your belly button, so on the bottoms of your feet,
Okay.
and then you want to use like 2 drops. it I don't need to see you like this. Like you don't need all that. Okay, start off with like 2 drops. See how your body feels after you do the 2 drops. You may need more, you may need less, and go from there. Um, there are hot oils. So hot oils are those spicy foods that turn out to be spicy oils. So that's cinnamon, that's oregano. Um, the thieves blend, which is composed of cinnamon and rosemary. Sometimes that can be a little spicy on the skin. And so what you do, you take a carrier oil like your coconut oil or your avocado oil, and then you put it alongside your along with your essential oil and just keep rubbing it in, and that will usually calm it down. um, Also, just be careful with citrus oils because sometimes when you get in the sun, it can also get hot. So just put it where the sun don't shine.
Okay. Example of a citrus oil is
Lemon, grapefruit, lime,
okay.
all
All of
those.
those
Yeah, the
fruits.
citrus
Okay.
foods. Uh-huh.
Gotcha. Okay. So let's talk about joint health. We tend to deal
Mhm.
and see a lot of people who have arthritic conditions, those people who potentially just have bones that are aging. They're not moving as much and they're having more joint pain when they move.
Right.
Any essential oils that are super beneficial to joint health.
Yes. So joint health always starts from the inside out.
Mm-hmm.
Okay. Um, Most arthritic conditions, arthritis, osteo, rheumatoid, all
Mm-hmm.
of those things are composed because there's inflammation in the body. And inflammation happens when, for instance, I cut my hand. Immediately I've got all these fighting cells coming to the scene. I've got red blood cells, platelets doing their thing. That is inflammation, and that is great. And I need that.
Mm-hmm.
However, if my body is doing that on the inside constantly and there's no cuts, there's a problem. And that's
Right.
what we call systemic inflammation.
Mm-hmm.
And most of that comes from what we eat. Okay. So always, looking at diet first,
Mm-hmm.
is what I tell my clients. Making sure you're eating whole, real foods that don't cause inflammation. So that's cutting out the ultra processed packaged foods, the McDonald's, the fast foods, and eating real food that grows in a garden, okay? Or that have killed a pig, a cow, real food.
Yeah.
Um, so that's number one.
Mm-hmm.
Number two is there are some awesome oils that you can go to PubMed and, always don't take my word for it. Go to PubMed and do your own research. But that's where you can go and look up articles. But there's some great studies on wintergreen, peppermint oil. And actually, I have a blend that's already in a cream that I use. or that some of my people use, and it helps a lot. It's like the cream that's in the stores. I'm not gonna say no names, but it's the real thing, and it doesn't have any added toxins in there,
Okay.
so that it works more effectively. So that's wintergreen, peppermint, and copaiba. Okay. So that's, you can rub that on topically, and then internally, after checked your diet, sulfurzyme. There is a supplement called sulfurzyme, which has MSM in it. So not there's some people who are allergic to sulfa drugs.
Right.
This is sulfur. This is a natural mineral that we need for our bodies to function. So it has MSM in it, which has several studies that reference arthritis, osteoarthritis, and it helps to, at a cellular level, remove some of that extra inflammation. So I love that product, coupling it along with the oils and things topically, and people have been getting some really good results.
That's good. And then you just apply whatever to the joint that's giving you the problem.
Right. Let's put it where it hurts.
Okay. So you know how we tend to dose prescription drugs. Do we dose essential oil use the same or different?
That's a good question. So I always recommend, if you are using oils or supplements, natural products, that you first of all put some time in between where you are taking your regular medication. Because essential oils they'll dampen your meds. Like, they won't have as much as effect after there's oils in your body. So note that first. But as far as dosage or usage, it's really person by person. There's some people who all they need is a little, like I said, a couple of drops of lavender on their feet, they're out. Some people need to use oils throughout the day, depending on what's going on.
Right.
Like I'll do, for instance, my little girl wasn't feeling well on Monday. So I do something called ramping up. We call it ramping up, where I apply oils every 30 minutes in order to get a desired result. And I wanted her immune system to ramp up. That's what I wanted. So I applied it more. So does that answer your question?
It does.
Okay.
So for the person, okay. So say they applied it once in the morning. For us that think that we should take medication 2 and 3 times a day, or we can apply like ice and heat as many times as we need it throughout the day, does this work the same? Depending on the person.
It depends on the person. It depends on what's going on. Now, if it's for like soreness, like just apply it as many times as you need.
Yeah.
It's not like medication. Like, there's no side effects.
Thank you.
There's no overdosing on essential oils.
Gotcha. That's good to know, because a lot of us, especially if we are going to ingest it by mouth, we think that, oh man, I can't have but so much of this, or I don't want to overdo it because I don't want to have any negative effects. But that's good that you mentioned that. Okay. You want to say something?
Yeah. I was going to say, if you're ingesting oils, you just need to see how it affects you. I wouldn't do like 12 drops of oregano in a capsule. Like, that's not a good look. Right. You're going to be burping up a lot of oregano. So that's why I said always start low in your dosage. See how you feel. If you feel like you need to add a little bit more, go ahead. But just if you are doing something internally, make sure you have some carrier oil to go along with it, so it won't get that. Oregano is hot. Frankincense, you might get a little, burp afterwards. So yeah.
Gotcha. Okay. So, you mentioned it a little bit earlier when you talked about lavender oil for mental health. A lot of times when we're dealing with older adults, there's seasons of depression, also times when we just feel like we're just not ourselves. Like today in this area, we've got a lot of rain and we don't have a lot of sun, and that affects your mood. So any other oils other than the peppermint and lavender that you mentioned that are good for your mental health?
Oh yeah, there's tons. There's a study in Germany.
Mhm.
Actually, they have, instead of putting antidepressants as the first response for depression, they have switched to lavender oil in a capsule.
Nice.
It's that powerful.
Mhm.
Other oils, I call them the happy oils. That's the citrus. So
Okay.
lemon, orange, lime. There's a couple of blends that actually have like joy. That's one of them. Liang Liang is another great mood oil. I'm trying to think of something else.
Any of them that don't have an odor.
Are there any of them that don't have an odor?
Mhm. I know, I see your face. Only because
Oh,
I
oh,
have
oh.
I have a few patients who have a sensitivity to smell. And so I'm just trying to see what could be a benefit to them that is not a lot of heavy scent.
Gotcha. So
Mhm.
I would go for a lighter scent. But here's the thing. Our nose has kind of been lying to us all these years because we've been smelling synthetic scents. So
Mm.
it's not that we have a sensitivity to the essential oil. It may be the fake rose scent or whatever we smelt.
Uh-huh.
However, I would say go very simple with familiar smells. So that's lavender, that's
Mhm.
peppermint, lemon. Um, those are pretty, you chew peppermint gum, chewing gum, start with those familiar smells and see how they do, and then see if they want to explore more. And sometimes some of the oils they don't smell too good. But them things work and I will use them and I don't care how they smell. I will put them on the bottom of my feet. There's one oil called Rutavala. It does not smell good, but Rutavala will knock you out. And I will put it on the bottom of my feet and put some socks on and be happy and go to bed. So
Hmm.
it just really depends on what you
Got you. Okay. Well, thank you. Okay, so another thing that I see a lot, people with hearing and vision loss. Are
Mm.
there any oils that are beneficial for those things?
There's an oil for everything. We can go through every system and I can tell
Uh-huh.
you an oil.
Well, that's
But
good to know because a lot
vision,
of times we
yes.
only think that we can go see our physician for this, and because we're in Western medicine, they're going to give us medication for it. But there are alternatives that can be possibly more beneficial, if not equally as beneficial.
And here's the thing, conventional medicine is new.
Mhm.
Conventional medicine has only been around the past, what, 100 years?
Mhm.
We've been using oils for thousands of years. We've been using natural means and herbs since God created them on the earth.
Mhm.
So this is nothing new. But we've just kind of gotten away from it. And we think that conventional medicine is best. And at times we need conventional medicine. Don't get
Right.
me wrong. However, I believe that the Lord made our bodies to heal itself
Mhm.
if we give it the right tools. And so these are just tools for healing. Okay.
Good way to put it.
Yeah.
Mhm.
But back to your question, eyes, frankincense is great for your eyes. And you don't put essential oils in the eye. That's a bad idea. But you can put it around it. And so I would
Mhm.
take like coconut oil and just one drop of frankincense, rub it together and just apply it around the eye, just making sure you don't get it in there.
Mhm.
Um, and the same thing for with ears. Those the things that little kids get a lot in the ears.
Yes.
You can put oils around the ear to help with that discomfort. Okay. And also with hearing, with anything, ringing in the ear. I've read some testimonies about, there's a blend called purification,
Uh-huh.
really good, that helps with like ringing in the ear or swimmer's ear or any of
Right.
that. Hmm.
Good. Okay. Skin is highly important. A lot of times
Yeah.
as we get older, I find that some people are just not showering as often as they used to for whatever reason, whether they can't get in there safely
Hmm.
or they feel as if, I'm not doing as much, I'm not getting that dirty, so I don't need a shower every day. But then we still have issues because our skin is our largest organ. It has to come over our joints. And if it gets dry, all things start not moving as well when it's not lubricated. So,
Mhm.
essential oils for our skin health.
Yeah, that's important. I was thinking about that earlier too, the skin tears and something that we commonly see. So you want to couple use your carrier oil when you're applying it on the skin, especially if you need that moisture.
Mhm.
So coconut oil is a great skin supportive oil, fatty oil. But to add to that, I would do frankincense, lavender, and also rose. Rose oil is really supportive for the skin. There is there's an ointment that's already made up. It's called rose ointment. Um, that I've seen a lot of really good results from diaper rashes to also just older people just
Mhm.
moisturizing like those elbows, whatever.
Mhm.
Um, yeah, and
Okay.
putting lavender straight up on a cut. We've done that many times instead of using something toxic like neosporin or those things.
Mhm.
Those are helpful.
That's good. That's really good. Okay, I'm gonna try that and I'll let you know how it works. Okay. And
Okay.
then let's talk energy because that's a thing. That's a big thing. I think we think as we get older, we stop moving as much, we retire, we're not going out the house as often. And then our energy level just plummets. Are there any essential oils that are specific to improving our energy levels?
um we always want to go back to the diet. What are we
Yeah.
eating?
Yes.
Also water intake with a little pinch of salt.
Hmm.
Um, and I'm gonna have you hold 1 second.
Okay. Okay. So we talked about sleep, we talked about skin health, we talked about energy levels and mental health and hearing and vision and all of the aids that we can have for our joint health as well. And so we've addressed like lavender oil, how well it is to put things on your feet where you have thicker skin and larger pores to get into your system, and in that it only takes 20 seconds for these essential oils to absorb into our bloodstream. So Dr. Lee was also talking to us about how important it is for us to have a good diet in addition to using these essential oils. And so we want to make sure that as we are aging, we're doing the right thing and getting our sleep, but also in eating well, and then possibly using these essential oils to support our health as we get older so we can age well. So at the bottom of the screen is how we can connect with Dr. Lee. We can text consult, CONSULT, to 256 525 1245, or you can visit her on her website at dranitalee.com/oils and find out more information about all the oils that she's mentioned on this recording tonight. So if you are watching and you have a question, you can always type it in the comments. If you are interested in having physical therapy and you live in the DMV area, you can contact us at LimbsNThings.com. Dr. Lee is back. And so she's going to talk to us a little bit about where we can find these essential oils in our local area.
Sorry about that, guys.
It's fine.
I just had to pull out the lavender real fast for my little girl she
Gotcha.
was having a moment. So if you want information, I always tell people it's best to go ahead and sign up with for a consult with me so that we can individualize and see exactly what you need and you're not just wasting money on things that you don't need. So you can text the word consult, CONSULT, to 256 525 1245. If you already know exactly what you want, you can go straight to my website, dranitalee.com/oils. And I also want to say this, everything that I talked about today is really, it really makes a difference on what oil you use, what brand of oils. You cannot internalize some of these oils. So make sure you look at sourcing, make sure they're doing better than organic practices, and so that you feel safe and confident when you're putting oils on your body.
Got you. So the person who's going to their local grocery store and finding the essential oils down there, or their
No.
local GNC and trying to find the essential oils in there.
Yeah, you're going oils are absolutely everywhere. They're
Mhm.
in gas stores,
The
Aldi, like
beauty
they're
supply
every
store, all of them.
don't do it. Say no. Call
Got
me and I'll show you where you need to go.
you. Okay, well, I thank you so much for joining us. Do you have a final thought to wrap up everything we talked about tonight and how we can use essential oils to age well?
Yes. I think that, well, thank you for this opportunity. Like, this is
Sure, thank
awesome.
you.
I'm learning things now that I can help my parents with that I didn't know
Yeah,
about.
yeah.
Um, all of my grandparents have passed away. They have not met any of my kids. So
Mhm.
it's one of my missions in life to educate people about the God-given resources that we have here on the earth to serve us, to help us
Mhm.
thrive as we age. You don't have to let something hereditary define you. Matter
Absolutely.
of fact, most of the diseases that are out there, only 5% are passed down to the next generation. But we've been, told a lot of lies. And so I want to encourage you, start off just trying a couple of oils and see how you do. And I think it's going to be awesome.
Absolutely. So again, if you want to connect with Dr. Lee, drAnitaLee.com//oils, or you can text consult to 256-525-1245. And if you ever need physical therapy and you're an aging adult in DC, Maryland, or Virginia, you can always contact Limbs and Things. Thank you so much for joining Pull Up with Limbs and Things tonight. Have a wonderful evening, Dr. Lee, and thank you so much for your time.
Thank you. Thank you for having me. Have a good one.
You too.